Hello, and welcome to the podcast, Harmful Ocean Waves, Climate Change, and the Threat of Flesh-Eating Bacteria. Have you ever wondered if the beautiful, tranquil beaches we visit to relax are hiding an invisible danger that climate change is silently amplifying? Join us as we explore the answer in this fascinating episode. Before we dive into this critical information, we kindly ask you to subscribe to our channel and share this podcast with your friends and family to spread useful knowledge and help everyone protect their health and our environment. Your support is the greatest motivation for us to continue delivering high-quality content.
Part 1. The Invisible Threat from a Warming Ocean. Hello, dear listeners, and welcome to our special podcast episode, where we will shed light on an urgent issue that is becoming increasingly serious due to the impacts of climate change: the alarming rise of flesh-eating bacteria, specifically the Vibrio vulnificus strain. Have you ever considered that a small scratch on your leg near the ocean could put you in a life-or-death situation? The story of Leonard Lyons, a fisherman from Louisiana, USA, is a frightening reminder. From just a small scratch on his leg while setting out crab traps, he had to fight for his life with doctors for hours. The initial symptoms were just delirium, fever, and vomiting, but then black spreading lesions appeared on his left leg. That tiny scratch became the gateway for Vibrio vulnificus, the invisible enemy we call flesh-eating bacteria. Mr. Lyons was lucky to survive, but the experience completely changed his life. He was diagnosed with necrotizing fasciitis, a serious disease caused by Vibrio vulnificus that affects tissues beneath the skin. Doctors fought to save his life and his leg, and he was told he only had a 50% chance of survival. This isn't just an isolated personal story. Scientists are warning that severe infections like Mr. Lyons are on the rise, and climate change is the primary culprit behind this disturbing trend. We are witnessing a growing public health threat, not only in traditional coastal areas, but also in new geographic regions. So, how exactly is climate change affecting the proliferation of this bacteria? And what can we do to protect ourselves and our families? Stay tuned to learn more about this complex connection.
Part 2, Vibrio vulnificus, the silent killer and how it spreads. Now let's take a closer look at this invisible enemy, Vibrio vulnificus. This is a naturally occurring bacteria that thrives in coastal waters, especially during warmer months and in brackish water, where fresh water mixes with salt water. What's alarming is that although rare, about 1 in 5 people who contract Vibrio vulnificus can die, sometimes within just a day or two of getting sick. So how can we get infected with this dangerous bacteria? There are 2 main pathways. Exposure through an open wound in seawater, just like in Leonard Lyons' case, a cut, scratch, or any open wound on the skin, no matter how small, can be a gateway for Vibrio vulnificus to enter the body when we come into contact with contaminated seawater or brackish water. For people with weakened immune systems, the risk of infection and serious complications is significantly higher. Mr. Lyons, who has diabetes, had to endure a difficult and painful recovery process that lasted for months and is still ongoing. This emphasizes the importance of being highly vigilant, especially for those with pre-existing health conditions. Consuming raw or undercooked shellfish, Vibrio vulnificus can also be transmitted through the digestive tract, especially by eating raw or undercooked shellfish, most commonly raw oysters. Oysters are filter feeders, meaning they get their food by filtering seawater. When the seawater is rich in bacteria, a single oyster can contain millions of Vibrio vulnificus cells. This is why in Louisiana, restaurants that serve raw oysters often have clear warnings about the risk of foodborne illness. Although Vibrio infections from food are generally less severe, causing gastrointestinal symptoms, the bacteria can sometimes enter the bloodstream and cause serious illness. Previously, cases of Vibrio vulnificus infection were mostly concentrated in the Gulf Coast region of the United States. However, as we will learn in the next section, this situation is changing rapidly, and climate change is playing a central role in the geographical expansion and increase in the number of cases. This shows that none of us can afford to underestimate this threat, no matter where we live in the world.
Part 3. Climate change, the driving force behind the bacterial explosion. Now let's analyze the core of the issue, the undeniable link between climate change and the rise of flesh-eating bacteria. Scientists have provided clear evidence that warming oceans and rising sea levels caused by human-driven climate change are significantly increasing the risk of Vibrio infections. Let's look at the specific factors. Warming seawater. This is the most crucial factor. Vibrio vulnificus is a bacteria that loves warm temperatures. As seawater temperatures rise, they multiply more vigorously. Scientists have noted that this dangerous bacteria, previously concentrated mainly in the Gulf Coast, is now being found much farther north along the U.S. East Coast. This is a clear demonstration that the bacteria are expanding their geographic range in response to a warming ocean. Decreased ocean salinity. Professor Jim Oliver from the University of North Carolina at Charlotte has pointed out another equally important factor, the decrease in ocean salinity. As glaciers melt due to rising global temperatures, a large amount of fresh water pours into the ocean. Salty seawater has a salinity that is too high for Vibrio vulnificus. However, when fresh water dilutes the seawater, conditions become more favorable for the growth of this bacteria. This creates a new ideal habitat for them, even in areas that were not previously their natural home. Winter survival. Another consequence of a warming climate is that more bacteria survive the winter. This means that when summer arrives, bacterial outbreaks will be worse because we start with a significantly higher baseline level of bacteria than before. This is an alarming cycle, creating a negative feedback loop where each year could be worse than the last. Statistical evidence and geographic expansion. The statistics are the clearest warning. The U.S. Centers for Disease Control and Prevention said that Vibrio infections along the U.S. East Coast increased by 800% from 1988 to 2018. Let's look at some specific states. Louisiana reported 17 hospitalizations and 4 deaths just by the end of July, more than double the number typically seen. Massachusetts identified an extremely rare case of Vibrio vulnificus infection from a resident who was exposed to coastal water near Martha's Vineyard. To date, the state has confirmed 71 cases with a 30% hospitalization rate. Virginia has seen Vibrio cases increase over the last 10 years. North Carolina has recorded a 620% increase in the last decade. New York has also seen its case count more than triple. Dr. Rachel Noble, a professor at the University of North Carolina at Chapel Hill, who's been studying Vibrio since the early 2000s, says that the increasing prevalence of this potentially dangerous bacteria is being replicated globally. She warns that this is just one example of other pathogens that will also increase due to climate change, showing the complexity of the issues related to climate change. These numbers and scientific evidence are not just dry statistics, they are alarm bells about a real threat to our health and the planet. We cannot continue to ignore these signals.
Part 4.
action for change, protecting ourselves, and working together to save the environment. Now that we understand the threat from Vibrio vulnificus and how climate change is fueling its spread, the most important thing is what we need to do. This is the time to turn awareness into action to protect ourselves and our community while also moving toward a more harmonious and nature-friendly lifestyle. Changing habits to protect personal health. Absolutely avoid contact with seawater if you have open wounds. If you have any cuts, scratches, or open wounds, no matter how small, assume that coastal water could be contaminated with Vibrio and avoid entering the water. Clean wounds immediately. If you are injured near the ocean, wash the wound thoroughly with soap and clean running water. Be cautious with raw or undercooked seafood, especially raw oysters. Always be aware of the source of your food and consider the risks, especially if you have a weakened immune system or pre-existing health conditions. Seek emergency care if symptoms appear. If you develop symptoms like fever, chills, body aches, or skin lesions after contact with seawater or eating seafood, seek immediate medical help and go to the emergency room. Leonard Lyons emphasized that a misdiagnosis can be a death sentence. Early diagnosis and timely treatment are key factors in saving lives and limbs. Working together to protect the environment and live in harmony with nature. Minimize our impact on climate change. The threat from Vibrio vulnificus is just one of many negative consequences of climate change. Each of our small actions, from reducing energy use, recycling, using public transportation, to supporting sustainable products, contributes to reducing carbon emissions and slowing global warming. Raise awareness and educate. Share this information with family, friends, and the community. Educating people about the importance of protecting the environment and the health threats posed by climate change is the key to creating larger-scale change. Mr. Lyons is also encouraging local leaders to increase warning signs at coastal areas to raise awareness for both residents and tourists. Develop a nature-friendly lifestyle. Let's not see nature as just a resource to be exploited, but as an inseparable part of our lives. A healthy environment will lead to good health for people. Let's work together toward a sustainable life that respects and protects natural ecosystems.
Conclusion and call to action. Dear listeners, through this podcast, we have explored a disturbing aspect of climate change, the rise of the flesh-eating bacteria Vibrio vulnificus. This is not just a scientific issue, but also a story about public health, how we interact with the environment, and the responsibility of each individual in building a better future. We sincerely thank you for taking the time to listen to this meaningful podcast. We hope the information we've shared will help you raise your awareness, change your living habits to protect yourself and your family, and inspire us to work together for a cleaner, greener planet. If you found this podcast helpful, please don't forget to subscribe to our channel, share this podcast widely with everyone, and leave positive comments below. Your feedback and support are invaluable and help us continue to produce high-quality content and spread useful knowledge to the community. Let's become informed consumers, responsible citizens, and dedicated environmental protectors together. We look forward to seeing you in the next episode. Important note: the content of this podcast is for informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. If you have any health concerns, please consult a qualified physician or healthcare professional.